Hey, EO Live TV, thanks for joining us today. And this is our bi-weekly COVID update. And as always, it's great to have Carrie with me. And Carrie, thanks for jumping in today. How you doing? Let's start with just how you are personally. How are you surviving this?
Well, I'm doing okay. I think just like everybody else in the world right now, there's still so much uncertainty and life is definitely still different than it was before. But I think that, we're all continuing to do the best that we can in unprecedented times. And again, just grateful to be here today and able to talk to folks about what's going on related to COVID.
Good. Yeah. And just to remind our viewers, we're monitoring the Facebook stream. And so if you have comments that you want to add or questions, we'll do our best to monitor those and pull those into the stream. So, I watch the numbers every day, and we seem to be doing better. I know that those kinds of things happen. You're kind of like hold your breath because it's hard to know if it's a trend or if it's real or if it's just temporary. But I don't know. Kind of give me your evaluation of that if you can.
Yeah, I think it's really always a good day when we see a zero in our case counts. Of course, that's what we're going for. We want to keep the spread as low as possible. We want to keep the number of cases as low as possible. So, it's always really grateful to see that. I think it's really hard to make a good determination about whether or not that's something that we can expect to see, whether it's temporary. I think we continue to monitor what's going on both in our region, in our state, and the country, and in the world to kind of see what the activity's like. And the reality is that we're still seeing, quite a few cases here in the state of Oregon. We're still seeing some of our neighbors like Umatilla County really experiencing pretty significant case counts each day. So I think that the reality is that right now we seem to be in a good spot. We seem to have a low number of cases. We can't really predict what's going to happen in the future, but I'm really, really grateful that our community has taken to heart the recommendations that we provided, that they're doing the mitigations that have been asked of them. And I'm hopeful that those everyday actions that the members of our community are taking are really making a difference and are really doing what we need to do to keep each other safe. So I hope we keep going in this direction.
When I'm out and about, I see very few people, and I mean, I can't really think of anyone who is not compliant with the masks or the distancing requirements or so on and so forth. So people complain, and people will always complain, but I'm just thankful that they're compliant. And, at the end of the day, doesn't really matter why they're compliant. If they're doing it willingly or if they're not, what matters is that they are, and we're doing something to at least do what we know that we can do. So,
absolutely.
Yeah. Let's talk about RAP. Explain what that is a little bit, and I'll put the information on the bottom of the screen too. But talk to us about that program and how that can help folks.
Yeah, so as you all probably know, one of the things that happens when we're trying to keep the spread of COVID-19 low in our community is that we ask people to take really specific actions like isolating and quarantining depending on their circumstances. So if you're sick or symptomatic or have a positive test result, we ask you to isolate. If you've been a contact with somebody who has a case of the disease, a close contact, somebody that fits the criteria that we think really put you at risk for becoming ill yourself, we ask you to quarantine. And we're asking people to do these things for a fairly long period of time. It can be up to 14 days, maybe longer, depending on your individual circumstances and your household and who you've come into contact with. So, we realize that this can be really challenging for many members of our community, that there can be things that people just need help with. People might not have folks that can go get something simple like their groceries for them. They may need medications picked up. They may not even live in an environment where it's possible for them to isolate or quarantine from others. So maybe we need to find an alternate location for them to stay during that period of time. There are many, many scenarios where people in our community need assistance doing what we're asking them to do. So as a result of that, what we have done is put together what we call wrap services. And the idea is it's wraparound. So it's basically like whatever needs you have, we will do our best to try and meet them. So some of the services, I mentioned a few of them, but I'll go through others again. Financial assistance. If people are needing to stay home and aren't having the same level of income, maybe they need help paying some bills. Maybe they need food bank, grocery delivery or pickup. Maybe they're uninsured, and because of their illness, they could benefit from health insurance. Any type of service that somebody might need to help them do what they've been asked to do is available through the wrap services. And, I can't say everything, but the idea is that you have somebody that can help you navigate your own situation. So I know that you said you were going to put up the phone number, but I'll read it out really quick. It's 541-962-1610. And there's also an email address, which is COVID wrap SBCS, so short for services, at union-county.org. Again, you've got those up there. So I think the thing that's really great about this is that it capitalizes on the strengths of our community, things that we already do really well, which is community-based organizations and other service providers coming together to support our community. So, CHD is working with numerous community-based organizations, numerous partners in our community to coordinate these support services so we can make them easily available to members of our community. So we're really grateful to have so many wonderful community-based organizations and partners that have stepped up and are really trying to make sure that the resources that folks need are easily available to them.
Well, and that's great. And I know there's been individual efforts to assist in those kinds of things. And so it's awesome that you guys are providing kind of a clearinghouse or a place for those people who do really want to help to be able to funnel their efforts and so on and so forth. Yeah. So, yeah, well, thanks so much. And are you getting some positive stories from that service?
I don't know that I've heard any specific stories, but I do know that, it's definitely being used. And I do know that we've had now that I think about it, we've had some really specific situations come up where people just needed somebody to drive to the pharmacy and pick up their medication, and we're able to arrange something like that. Or maybe somebody's in a situation where a medication isn't covered by their pharmacy, so we try and problem solve that with them. And then just really basic stories of people needing a food box and having somebody to deliver it to them. And then we've also had situations where we'll partner with the people that are building the food boxes to add other items in there that people might need. I know that the need for toiletries came up, so people don't have some of those basic items that they need. And our community connections partners stepped up and provided those to our wrap coordinators so we can make those types of things available. So again, it's just identifying a need or a gap in the system and then reaching out to our partners that we're meeting with on a regular basis and saying, hey, we identified this as a need. Can anybody help? And the reality is that our community is usually able to step up and find a way to meet those needs, which is one of the reasons I love living here.
Yeah, you're absolutely right. How good it is when we can serve each other and meet each other's needs. Yeah, that's awesome.
Yeah, and I do want to, I just remembered, We had the opportunity to speak with a reporter from the Observer today. We're really grateful that they're actually going to do a story to highlight some of the work that's been done. So there'll be some specific information coming out in that story that's forthcoming as well.
Good. So the governor recently adjusted the mask requirements and some of the other things, the gathering requirements. Talk about that a little bit, if you would. And then also, I know one of those requirements is masks for children. And I know you have kids. I don't know. Talk about the governor's her changes, and then how personally has that affected you, and how have you kind of dealt with that?
Yeah, I'm happy to talk about that. The governor has continued to, modify the executive orders that she has in place to try and respond to the latest trends in the transmission of the virus. And so last week, she did change gathering sizes, both for, I believe, social gatherings and venues, and then the mask requirements. So I think that I will be honest with you, I haven't had time to memorize all of the details of the governor's executive orders because there are a lot of changes. So I will always encourage people to go to the Oregon Health Authority website where you can find all of the guidance documents and really make sure that you understand them for a specific situation. But the bottom line is that these orders that the governor is putting in place are really just mechanisms to reinforce what we've been talking about all along, which is that we need to maintain physical distancing to slow the spread, that we know now with scientific studies that have been done that masks greatly reduce the transmission of the virus, that the basic preventive strategies that we've been talking about all along, when you put them all together, they really, really do reduce our risk. And so these executive orders are really designed to encourage us to think about group sizes, really limit our group sizes to places where we can physically distance, and keeping that in mind. And then obviously wearing our face coverings in indoor public spaces, and also outdoors when we can't maintain physical distancing. Now, we know that the disease, or I should say, we believe at this point the disease doesn't transmit as well outside. But if we're going to be in close contact with people, the masks are still, again, just one more mitigation that we can put into place to reduce our risk. So the governor did also, as you mentioned, increase the requirements for ages related to the face coverings. So now children 5 and above are also required to wear masks in the same situations and settings where an adult would. So again, the indoor public spaces and outdoors where physical distancing can't be maintained. And, like you said, I have children, and I actually had a recent experience where we made a shopping trip with our face coverings, very, very cute and fashionable face coverings. And I actually almost, I did try to pull out my video camera, but I'm not super tech savvy, because I had one of my kids was, continuing to pull the face mask down and playing with it. And I would give reminders and say, you really need to keep your hands off of it. You really need to make sure you're covering your nose, and really trying to coach her on what she needs to do to have this be an effective tool to keep the people around her safe. And, I think, again, her feedback to me was that she was having a hard time breathing, which, I can totally understand. And I think that these are all things that, parents or teachers, childcare providers, anybody who is in a situation where they're working with kids are in a place to coach them, give them feedback on how they're doing it. But what I also know about kids is they're pretty adaptable and they're pretty easy to learn things. And so, the other child was doing just fine with it. So I think it might take a little bit of time. And I think there was some intention in the governor changing this order at this time, because I believe that it helps our students get ready to wear the face coverings before they go back to school. And it gives them a little time to practice. And frankly, it gives them a little bit of time to also maybe find one that fits them, because I know for me, I had to do some trial and error with the face coverings. Like, I tried a few different varieties before I found one that really, really worked for me. And when I did, now I'm so used to wearing it, I actually feel a little bit strange when I go into an establishment and I don't have it on, because it's kind of like my seatbelt now, where I'm just so used to wearing it that I really notice it if I don't have it on. And so I think initially it was a tough transition for a lot of people, but I think when you get used to something, it's manageable.
Yeah. And I agree. And I think that, like I said, I've seen very few people that were not complying. And, we all have different things. You and I have been talking for several months now how I do not like to be driven by fear, but at the same time, and so if I'm not required to wear a mask, if I'm outside space and if I'm outdoors and it's not a public space and there's lots of room, there's no way in the world I'm going to wear it. But on the same hand, I'm conscious of the people that are around me, and you can sense, part of the point is that I give way, and that's part of being human being, part of being compassionate, is you give way to the comfort of others. So in other words, if I walk into a place and even though we're socially distanced and it's outdoors and they're all wearing masks, then I'm going to kind of clue in that they're going to be more comfortable with me if I'm wearing one also. And so even though I might not buy in, and I'm not saying I don't, but even if I'm a person who doesn't buy into all of the rationalization and all of the reasoning and so on and so forth, we still, as human beings, we give way to each other. That's part of what we do. It's the part of the way that we get along with each other is we find common ground, and it's a lot easier to be safe in these kinds of things. In other words, to wear a mask even when I'm not required to, than to not wear it. That's part of me just giving way to my human brothers and sisters and being compassionate. So.
Yeah, I agree. This is really about taking care of each other. And like I said, I feel really hopeful given what we've seen in the last 2 weeks with the case counts here in Union County. And I feel really strongly that our actions as individuals and as members of this community make a huge difference in that number. But I really also have to remember that yesterday we saw a very grim milestone in the fact that we had 14 deaths reported in our state. And that was the largest number that we've seen thus far in the pandemic. And so while I'm hopeful given what we're seeing locally, I think that, I also am constantly reminded of the fact that people in our state and in our communities across Oregon and beyond are losing family members. And so I feel like if there's a role that I can play in reducing the chance that one of them becomes ill and that a family has to experience that, or that my family has to experience that I'm willing to take those actions.
Yeah, I have a message here from Facebook, and it kind of relates to the next thing, and that somebody posted, what happens if you have a child with underlying breathing issues and has no problem, with underlying breathing issues and has no problem with wearing a mask, he has a low immune issue. He has low immune issues. What about school? And that's a whole nother thing that, I know that the governor recently, yesterday, I believe, started releasing some information about how school should be. I don't know, maybe to kind of roll into those issues. If you can answer this question and kind of roll into the school issues.
Yeah, well, I think my recommendation for any parent would be, especially a parent that has a child with an underlying medical condition, is that they have a conversation with their healthcare provider. I think that is going to be the place where you're going to get the best guidance, because your healthcare provider is going to know your child's condition. They're going to know the research related to the virus around the condition of the child. So, I mean, I would defer any, individual decisions around, how to proceed with your child to a conversation with your healthcare provider. So, again, I think the mask requirement, I will say, I just went back and looked at it again, and that everyone 5 and older is required to wear a mask. And people can, if people have a health issue that doesn't allow them to wear a mask, and there are reasons, and we've talked about this before, Brent, that there are some people that can't wear masks, and that we shouldn't be making judgments on people in our community if they're wearing a mask, or if they're not wearing a mask. Like,
Right.
We can't look at somebody's outsides and know their reasons behind making these decisions. So, I think we also have to keep that in mind, that there are some cases where it is not going to be appropriate for somebody to wear a mask, and we need to be respectful of our fellow community members. So, again, people can request accommodations. There are mechanisms for people to get their, their needs met through local businesses. So I want to remind people of that, because I don't want this to become an issue where we're being unkind to each other, I guess, for lack of a better way to say it.
Yep. And I couldn't agree more. And it goes both ways. It's those people that are hypervigilant about wearing masks, not judging them for not wearing them. And the same way, the other people that are a little bit more relaxed about it, essentially in their mind calling someone a name because they're driven by fear, or whatever it might be. Yeah, it's like can't we just give each other a break? And anyhow, so schools, talk about how do you? I mean, and we are, we are soon. I think next week. And I'm not sure it's going to be on EO Live TV or not, but the school district, I know, is going to have a town hall meeting, and they're going to be talking about locally what it's going to take to get back to school, and so on and so forth. So I know more information is coming from that, but kind of what do you see from the governor or from the state as far as how they see school happening?
Yeah, so I feel like we got a little more information yesterday, and I've said this before probably here, but the one thing that I'm certain about is that things are likely to change. And I feel like as we move through the course of this virus and we're getting closer to the fall, the state and the Oregon Health Authority and the Oregon Department of Education are continuing to provide recommendations and information to help local decision-making related to school reopening. And I know that there are a lot of folks that are eager to have their students back in school. I totally understand why. I totally understand the value of in-person education. And I think that, our state leaders are trying to balance that, value for in-person education with keeping the students and the staff safe. And so yesterday, the governor did come out with a set of metrics that can help us guide decision-making around whether or not schools should be conducted in person, or whether or not we need to have a comprehensive distance learning model. And so, the metrics really do, there are county-specific metrics, but then there are also statewide metrics. And so at this point in time, I know that the local school districts have been following guidance that has come out from the Oregon Department of Education earlier this summer, and they are diligently working to write reopening plans for their districts. I know that they are gathering input from a broad group of stakeholders. I know that they're consulting with their school boards and their communities, and they're working so hard to come up with a plan to get schools back to normal in the fall, as normal as possible, but also keep everybody who will be in the school environment as safe as possible. And so I think over the next week, we'll be, we meaning public health, but also all of the school districts will be looking at the guidance that came out from the governor, looking at our local data, looking at the state data, and then, obviously using that information to inform decision making about how things look when school starts. And I don't have that information yet, and that's really going to be up to the school districts to share. But I think that now we have, at least as of yesterday, a really specific set of criteria that will contribute to decision making about what modalities students will be learning under come September or even August. That's a few days away.
Yeah, and it's got to be fairly complicated. I mean, I just know that the educators are trying to figure out. I mean, they were wounded. I mean, the whole education process was wounded by having to quit school in March, and because there's no way that you can expect that education, you're going to flip a switch and that education is going to continue on. By that, I mean that particular student continuing to learn at the rate that they were when all of a sudden they're not in person with a teacher and so on and so forth. So yeah. I would imagine that they're panicking to try and figure out, okay, at the end of the day, how do we teach kids? I mean, that's what they care about. It's like, how do we advance their education and move them to the next grade level? Those kids that were in the second grade last year and they missed the last 3 months of school, how is it going to be like to get them into the third grade? Are they going to be at grade level? I mean, there's just a whole host of questions, I'm sure, that are way beyond all of us. But yeah, what a nightmare. Somebody submitted a question here. So and we've kind of talked about this several times, but if someone is, they think that they might have COVID or they're sick and they decide to stay home, which they should do, and isolate themselves and move through that illness, do you think that they have a burden or an obligation to be tested for COVID if they are moving through that process, whatever that sickness is? I mean, it might be a cold, it might be COVID. Do you think they have an obligation to be tested for that?
Well, I don't know that I would say anybody has an obligation to be tested. I think that at this point in time, given the testing system challenges that we've heard about, I think it's been reported nationally that there are potential supply chain issues, and that the private laboratories that are doing testing have been fairly backed up. And so the reality is that the wait times for testing can be fairly long. And so at this point in time, if you have COVID-like illness and you're not sick enough that you would normally see your healthcare provider, really, we're not going to tell you to do anything different if you get a test or don't get a test. We're going to ask you to stay home for 10 days and make sure that you have been fever-free and that your other symptoms have improved for 24 hours. Now, that's a change since the last time we talked. That was 72 hours for quite some time, and that has recently been reduced to 24 hours. But still, if you've got those symptoms, we'd need you to stay home. So, the test, it doesn't really change the recommendation. I understand people want some reassurance and they want, to know definitively whether or not that's what's causing their illness. So, I think if they're ill enough to see their healthcare provider, and the healthcare provider, it's at their discretion as to what tests they run, wants to determine whether or not that's the cause of the illness or something else, because, there's still other illnesses, other viruses, other diseases that are circulating in our community. And in the fall, we'll certainly see flu come back. I think I wouldn't say, I can't remember the term that was used. I don't know that people absolutely need to get tested. I think we need them to stay home if they're symptomatic. Really, that's the most important thing. So we stop it from going to anybody else.
Good. And the 24 hours without a fever, where does that kick in at the end or at the beginning? I don't clarify that a little bit.
Well, it's very confusing. So, and it's, things change. So we get 10 days from your onset of your symptoms. And so if within the 10 days your fever goes away, you can be a minimum of 10 days But let's say you have gone 12 days and you still have a fever. We need your fever to be gone for 24 hours before you go back out, because we believe that the transmission is going to happen if you still have a fever. So we really need that fever to be resolved without the use of fever reducing medications too. So that, as again, so if your fever goes away within that 10 days, you're good. If your other symptoms improve within that 10 days, but what we're also hearing is that there are some cases where people's symptoms can go on for quite some time. And so if you're at day 21 and you're still symptomatic, we really need you to also stay home.
Okay. I think I understand that. All right. Well, hey, I'm going to put the address up again about RAP and that information for those folks that need assistance. They have COVID and they're isolating at home, and whatever it might be, if you're having troubles getting groceries or getting medication or whatever the case might be, there is, they can call this number or email this link, and somebody can reach out to them and help them with that. So is there anything else, Carrie, before we take off today?
I think that's all I have today. I just really appreciate you allowing us to come talk each week or every other week now, and just give the community update. It's great to have this space. So thank you.
Yeah, you bet. And thank you, EO Live TV, for jumping in with us today. Thanks for the questions and comments. That always makes it a more active, more relevant conversation. And we will